That breaking news we're following.
And we're going to go listen to Governor Lamont. He is giving us an update on the coronavirus.
Like a monthly briefing, but a lot happens over the course of a couple of weeks. So wanted to update you back with our usual cast, which is Paul Mounds, our Chief of Staff, and Manisha over at Public Health, Josh Jabal over at Chief Operating Officer, and backed by popular demand, Connecticut's very own best-selling author, Scott Gottlieb, who, as you know, is also on the board of Pfizer, former head of the FDA, and has been very helpful advisor for the state of Connecticut. Just give us a little bit of a look about what has happened over the last 3 weeks and a little bit of what we might be able to expect for the next 3 months and beyond. Very quickly on the summary, a couple of things you ought to note. 4,800 positive COVID tests since yesterday, one of the highest ever, but half of where we were, just a couple of weeks ago. So that gives you a good idea of what the trend is on infections. We are probably one of the 5 lowest infection rates in the country at 13.29%. You may go, my God, that's such a high percentage. That gives you a little bit of an indication of what is going on elsewhere around the country. But the good news is the infection rate is way down from 25% just 10 days ago. Hospitalizations, which, as you remember, was a metric we always paid attention to, did not want the bathtub to be overfilled in terms of making sure we can take care of everybody in need. Our hospitalizations down 72, the lowest in a couple of weeks. Probably a couple hundred less than where we were then. That's opening up beds. And by the way, we have a lot more nurses returning to work than having to quarantine. So we're also, I think, beginning to balance supply and demand. That's incredibly positive. Not so positive, fatalities, 241. That's a very high number. Almost all of them unvaccinated, older, comorbidities, a number which is a lagging indicator. I think that number is going to go down, but all our prayers. Next up, the Omicron impact and last winter's surge. This is sort of interesting in this sense. That vertical axis there on the left is gives you an idea of what was the high water mark. So if in July we were about common, you'll see that light blue line, that's cases. You can see cases were up well over 400%, a lot more COVID-related cases compared to, say, the biggest surge last winter. But you can see that cases and hospitalizations are no longer directly correlated. Vaccinations work. So that yellow line is hospitals, still up a lot from the surge last winter, but down dramatically compared to where cases are, in ICU even more so in green. That case line, that light blue line, maybe reminds you a bit of South Africa, where you saw the Omicron go up and down suddenly. We hope that's going to be the case here. Next up, the risk of hospitalization, just similar to the last chart. The red line, you're not fully vaccinated. The blue line, yes, you are fully vaccinated. Who goes in the hospital? You can see it's 18 times or 7 times more likely if you're unvaccinated. And that's one of the reasons we got to get people vaccinated, keep you out of the hospital, maintain our capacity. And the next chart will show you not hospitalization, but risk of death. And here you can see the red line are folks who are not fully vaccinated. And there you're 18 times more likely to die if you're unvaccinated than if you are vaccinated. Look, nothing is 100%, nothing is foolproof, but it's yet another reminder that the vaccinations work. They keep you out of the ICU and they keep you alive. So all this talk about, hey, I had a buddy, I know he was vaccinated, he still got the infection, is it worth it? I think you're seeing right now, it is worth it. Keeps you out of the ICU and keeps you alive. The next chart is one place where we are continuing to pay special attention, that's nursing homes. As you remember, very early on, we mandated that all the nurses in the nursing home get vaccinated. And 92%, really good. 92% of the residents got vaccinated, and almost that many of the staff. But we also have to get people with the boosters. We've been sending the vaccination vans to the nursing homes. Almost 80% of the residents have gotten boosted. That is making sure that we don't have any big flare-ups there. And we have required the booster for the staff, for the nurses. They're only about 33% have gotten the booster. We've got another 3 weeks. I hope everybody takes advantage of it. We're getting the boosters out to all the nursing homes. And by the way, while we're at it, we're getting all the rapid tests out to all the nursing homes as well. Why are we doing that? What I hope is our last executive order. But we have said it's often people coming in from the outside to see a loved one walking into the nursing home. That's sometimes where you see some spread and infection. So we're going to ask that you either show us that you've been vaccinated, or we'll have a test there for you, not starting until Saturday. We're getting the tests out, now and tomorrow. But I think that's how we can keep your loved ones safe, despite a high community spread around the area. And by the way, you've heard some talk about, we've got a fair number of people in hospital beds. They're on the back side of COVID, but not 100% cured. We have asked nursing homes, if they have a wing where people can be there safely and isolate, if they can keep somebody isolated, could you take care of somebody who's in the last stages? They're not going to be intermingling with the rest of the population. This is not what you saw in places like New York 18 months ago. Very different. And I think we'll be able to do that and keep people safe. What's up next? Up next is testing. A big rush for the rapid tests, as you remember a couple of weeks ago. Hats off to our team. Hats off to Public Health and DAS. We've got over 3.1 million rapid tests distributed, most of them to the schools. We have another 500,000 going out tomorrow. So there's going to be a lot of rapid tests out there. Not everybody has to test every day. You've heard me say that before. But these are available as needed. If you feel symptomatic, if you feel like you might be at risk, get a test, and that will make you clear to be able to go back to work and go back to school. By the way, you probably heard that the federal government is launching their website, covidtest.gov. covidtest.gov. There, I think you're going to be eligible to get up to 4 rapid tests. Go online. I can't promise you how fast they're going to be delivered. There may be some supply chain issues there, but very soon you'll be able to get 4 per person per week. And along the way, tests are available at pharmacies, and the federal government has said those should be paid for by your insurance. So pay for those, up to 8 per person per month. And we have over 400 tests all over the state of Connecticut, making sure that testing is widely available to each and every one of you. Finally, 2 last things, and here Scott can be invaluable for us. The therapeutics update. It's still a very small supply that we have available to us, but I'm going to ask Scott to describe a little bit what he sees going forward in terms of in the last stages of Omicron and whatever that next variant might be. What's the mix of testing and therapies and vaccinations, so we have a new normal and we can manage through this? And since I can't pronounce any of those names, I'm going to hand that over to Scott in 1 minute. Last thing I did want to say, though, is regards the emergency executive orders and emergency authorization. As you know, I think the legislature in their wisdom said some months ago, let's make February 15th the cutoff date. That's in, a little less than a month. And we take them to heart. I want their input on these last remaining executive orders. We've gone from well over 300, now it's down at 11. And those end on February 15th, unless the legislature acts. You heard some of the executive orders are as regards nursing homes and vaccinations there, and being able to visit after a test. Some of them are as regards purchasing, so that if we are in a scramble to get rapid tests like we were a few weeks ago, we can move pretty quickly there. Some of it's as regards workforce. You know, nurses and teachers give our public health and education a little discretion so we can get people involved, people back into the hospitals, nurses, teachers as needed on a temporary basis going forward. And finally, masks, which will be probably the broadest discussion. You know, right now we have masks for kids in school who are less likely to be vaccinated. You know, I think we should continue that a little bit longer. But I say to the legislature, what say you? Because we've got February 15th that we need you to step up and make a call on this so we can keep people safe for a little bit longer. And if February 15th is too fast to be able to make a decision, just renew everything for 30 or 60 days. Give yourselves time to get it right and make sure we can have the flexibility we need to keep people safe. Anyway, there'll be some questions on that, but without any further ado, let me introduce Scott Gottlieb, who's got pretty good insights on what we might expect next.
Thanks a lot, Governor. I'll be brief and just offer some top line thoughts on where we are, where we're heading. You know, as you said, we have a rapidly improving picture around the tri-state region, certainly around the state, but we're not through this by any means quite yet. The pressure on the healthcare system is going to be a lagging issue. The healthcare system is going to continue to accrue cases, even as they have discharges. And even on a daily basis, we're still seeing new cases. We just see a declining level of new cases day over day. When you look at the leading indicators, they're certainly improving very quickly. So, for example, in the Boston region, they look at sewage, wastewater, and you see substantial decline in the amount of infectious material in the sewage wastewater, which is a good leading indicator. When you look at New York City, probably the best leading indicator is people who are showing up in the emergency rooms with COVID-like symptoms, and that's down substantially. Both measures aren't quite down to baseline, but they're down substantially, and they're good leading indicators of where we're heading. But I think as we get into February, we're going to have a better picture of what the overall outlook is here. And there have been people like me who predicted that Delta would be the last major wave of infection, and Omicron came along and surprised us. I think that there is a conventional wisdom right now forming, even among the people who, cautioned me that Delta wouldn't be the last major variant and that this virus had the capacity to mutate and surprise us. Now there seems to be more of a consensus building that this Omicron wave may well be the last major wave of infection. This may become the dominant lineage as we go forward, and we're going to be heading into more of an endemic picture as we get later into this year. But that's not a foregone conclusion at this point. But I think more of the consensus is starting to form around that. And so what does that look like? I think as we go forward, we're going to see more of a shift from population-wide measures, policymakers implementing population-wide measures to protect the public as a whole, and more towards trying to empower people to take individual actions to keep themselves safe as this becomes an endemic illness, and as this becomes a more routine part of life, as this becomes just another circulating respiratory pathogen that we need to contend with. And the goal is going to be to try to make sure people have the tools they need to do that they're properly empowered, but also have the tools to try to take steps to keep themselves safe. And then that gets to the therapeutics that you talked about. I think as we go into this year, we're going to see much more widespread availability of therapeutics. Certainly, as we get into the summer and the fall, they should be widely accessible. I think we're going to see much more widespread availability of testing, and hopefully we don't have a situation like we did here where we ran out of tests briefly or didn't have enough, certainly around the Christmas time period. And we're also going to see the vaccines reformulated. Pfizer and Moderna both working on Omicron-specific variant vaccines. Pfizer should have data on that in March. And it could be the case that with a variant-specific vaccine, if Omicron does become the dominant lineage and what we have to contend with, if we can fashion a vaccine that's specific to Omicron, it can not only provide the protection from symptomatic and severe disease that we're seeing with the current vaccine against Omicron, but it can restore the ability of the vaccine to also be a much more effective tool at preventing transmission. As we've seen, the current vaccine still does reduce transmission. It reduces your infectivity, it reduces the duration of time that you're infected for, but we do see breakthrough infections with the current vaccine. And there's a belief that if you have a vaccine that's specific to this variant, it could restore its ability to substantially reduce transmission, and then it becomes a even more important public health tool. So I think it's a long way of saying, as we get into this year, hopefully this Omicron variant will continue to subside, that we won't be surprised again. And I think many people believe that hopefully we won't be. Prevalence will decline substantially as we get into the spring and the summer, and hopefully we have that quiescent summer that we hoped last year would be before Delta came along. And as we get into the fall, we'll have a much different toolbox to deal with this that we've long talked about, but we'll finally realize that not just with the vaccines and the diagnostics, but also the orally available drugs like Paxlovid and others that should be coming onto the market. And so I'll pause there. I hope that we have a more optimistic future ahead of us with this. Thanks a lot, Governor.
Hey, Scott, let me just ask you, in terms of that optimistic scenario, is there a hope that right now our infections far outstrip our therapies? So there's going to be a supply-demand disconnect for the next month or two. Is there a sense that at some point, as the infections go down, the therapies go up, it's going to be as routine as Theraflu?
Yeah, look, I think so. I think that as we look, demand's going to decline substantially as we get into February and certainly March. You're going to see less infections, less demand for these therapeutics, and supply is going to increase substantially. So, just looking at this from the standpoint of Pfizer with Paxlovid, I think the company is going to produce 6 to 7 million doses in the first quarter. Second quarter, I think they've said somewhere on the order of 20 to 25 million doses. And I want to be careful with these figures. They've put these out publicly. I might just be misquoting them. So I encourage everyone to actually look at what they put out publicly. I think in the third and fourth quarter, they said 45 million each quarter. And hopefully, supply will expand as more manufacturing capacity comes online. So you're going to have a situation where you have rapidly increasing supply, rapidly diminishing demand as we hopefully get into the spring and the summer. And so that's going to allow you to actually build up a stockpile. And then at some point, hopefully, FDA will fully approve it. Right now, it's under an emergency use authorization. And that's going to allow the drug to be put into a normal distribution system. So right now, the government is procuring this drug and distributing it to states, as you know. But once you have a fully approved drug that's being distributed through the normal supply chain, it becomes much more routinely accessible where doctors can just write a prescription. People can go to CVS and pick it up. I think that's all going to happen this year, but it's going to happen against the backdrop, hopefully, of not a lot of demand for it. This will all play out in the spring and the summer. So when we come back in the fall, if infection picks up again, which we all think it will, we think this will settle into more of a seasonal pattern where it's a respiratory pathogen that will circulate in the cold weather. By that point, you'll have a widely accessible drug. You'll have stockpiles of it. You might have other drugs authorized at that point, not on the market. There's other drugs in late stage development, one by Roche. Gilead is reformulating remdesivir as an oral drug. So I think our overall toolbox is going to look much different when demand once again surges for these things, which hopefully won't be until next fall, winter, barring some, unexpected new variant coming, which we don't see right now.
Hey, thank you, Scott. And remember, Josh, Manisha, and Paul are here as well to take any of your questions.
Okay, we'll start questions with News 8. News 8. Channel 3 Eyewitness News.
Governor, we've been talking with the legislature about codifying some of your executive orders. Where does the vaccine mandate for state employees fit into those negotiations?
We have not asked for that to be continued. So at this point, the overwhelming majority of our state employees are vaccinated. With that mandate in place, we got a lot of people vaccinated at the last moment that otherwise would be the case. So right now, they and teachers, like everybody else, if you're feeling symptomatic, get a test, but no more mandate.
And as far as testing numbers and state data, obviously the at-home tests don't show up in the positivity rate or any of the data. Is there any consideration of relying more on the wastewater testing that we're doing in Connecticut or some of those metrics that would be a little bit ahead of hospitalizations?
Manisha or Scott, do you want to talk to that?
I can just mention a couple things, which is that, the state did have a partnership and we've seen the wastewater data from New Haven that has continued to be done, but that the state lab in Connecticut also is purchasing equipment so that we can do wastewater testing for a number of pathogens, which are helpful from a perspective of infectious disease surveillance in general. And so in addition to other pathogens, SARS-CoV-2, the agent that causes COVID, will also be able to be part of that surveillance. And we're looking at bringing that online from the state lab in the next several weeks to a couple of months. So that is something that we'll be able to follow in addition to what other partners are doing around us.
Okay, the governor and his team right there providing an update this afternoon on the status of the coronavirus here in Connecticut, and a very different situation playing out now based on what they're saying. We've talked a lot about this for the past few days, but they are painting a picture that we seem to have potentially peaked, and that over the next few weeks and months, we will start moving in a very good direction.
And this is something we had been waiting for because we saw that this surge was really incredible with Omicron. Today, the positivity rate at 13%, which is something good to see. It's been under 20% for a few days now, which is good, 13.29, as you just saw there.
And there was a number there of deaths, but I'm not sure if that was accurate because they were talking about a certain number of deaths, 200 something in the past week.
Yeah, 241 in the past week, which is obviously not a good situation. The governor reiterating that the majority of those people, unfortunately, were not vaccinated, and trying to stress once again that if you can get the vaccine, it makes sense to do so. Obviously, Omicron has proven that these breakthrough cases can happen even if you're vaccinated and even if you're boosted. However, the threat of going to the hospital and the threat of potentially dying from this variant is far less than if you are not vaccinated.
And if you are heading to a nursing home starting on Saturday, you will have to be vaccinated or show proof of vaccination or have a COVID test or proof of a COVID test. That's an executive order that he just recently signed, one of his latest, as they also debate now what to do with some of the outstanding executive orders that the legislature, he said, will now take up. So a lot of new developments today.
If you would like to listen, this is the updated full screen right there, 241 and 13.29 for the positivity rate. The press conference continues right now, so if you would like to listen to that, you can do so on the Channel 3 streaming news app. We are going to move on to the weather after what was a snowy overnight and now the possibility for